name is Lori West. I'm the director of the Alberta Transplant Institute, and I want to thank everyone for coming to this special session today. I'd like to first start by acknowledging that the Alberta Transplant Institute is based at the University of Alberta, which is located on Treaty 6 territory, which is a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. We also recognize the deep health and social impacts that colonization continues to have on Indigenous peoples, including health outcomes related to the COVID-19 pandemic. I'd also just like to start, for those of you that aren't familiar with the Alberta Transplant Institute, to tell you just a few words about this. The Alberta Transplant Institute is a virtual institute located at the University of Alberta. Our mandates include bringing together research, academic activities in research and education at the University of Alberta, as well as at other locations across the province, particularly notably in Calgary, together with clinical links to the clinical care provided by Alberta Health Services and advocacy for donation and transplantation across the province. And the seminar series that we have held for a number of years this year is, we're very pleased to say, is supported from a grant from Paladin. Today's special session is called Life and Death with 3 Doses, and we're going to be looking at the current situation in Alberta for transplant recipients. I'd like to acknowledge support specifically in the planning for today's session from the Alberta branches of the Kidney Foundation and tremendous support from the Canadian Transplant Association. So just a few words about what's currently happening, what's the state of affairs in the province of Alberta. I'm sure that most of you are familiar with where we stand in this rapidly evolving situation, but just a couple of specific elements that are going to have particular relevance to donation and transplantation and are particularly relevant to Alberta. First of all, Alberta has one of the lowest vaccination rates of any of the provinces. And in some rural areas, we know that vaccination rates remain in only the 40 to 50% range. Second, we have some of the weakest public health restrictions of any province in the country. And this is creating a confusion as well as increased risk, particularly for the patients who are involved in donation and transplantation. We know that broadly our healthcare system is overloaded and we are beyond the capacity of the normal capacity for our intensive care units in particular, and those have had to be stretched dramatically, as I'm sure you've heard about in the updates from as the days and weeks have gone by. And additionally, our children not only are affected by the healthcare system, but also our schools are affected. And the cases in schools are now uncontrolled as we haven't had contact tracing and other ways, other sensible public health measures for addressing this. So I'm going to introduce Heather Badenoch, who will be leading the discussion today with our panel. Heather is a non-directed living liver donor herself and a communication strategist. As the owner of Village PR, she advises not-for-profit clients in community and health communications. As an active transplant volunteer, Heather helps transplant candidates find living donors by running their public appeals, both small and large, pro bono. She also mentors potential living donors on the pathway to living donation. Heather's been an amazing volunteer with the Center for Living Organ Donation at University Health Network in Toronto, and she's been a big part of also of the Canadian Donation and Transplantation Research Program. So it gives me great pleasure to introduce Heather, who will tell us about the next steps in this session. Heather.
Thank you so much, Lori, for your very kind introduction. As Lori said, my name is Heather Badenoch, and I am your MC for the next hour. We're going to discuss the impact of the current situation on patients, on caregivers, and on donor families. Time permitting, each discussion will be followed by questions and answers. We'll be checking the chat for questions, so please put your questions in there. At the end of our session, we'll also be taking questions from any media attendees. We have a great panel of transplant recipients, a donor family, and clinicians as we dive into our topic. So to start, let's first get a sense of who we are in the room today, everybody attending. So we're going to put a poll on screen. Results are coming in. We'll see them on screen shortly. There we go. So we've got mostly other health professionals, many transplant patients or recipients, family members of patients and recipients, not-for-profit advocacy organizations. What a great range. Thank you everyone for coming today. That's terrific. We're now going to welcome our panelists. So I invite each panelist to introduce yourselves and then hand it off to another panelist. So please share your name and your connection to transplant. And why don't we hand it off to Tisa first to introduce herself.
Hi, my name is Tisa Pera, and I'm a liver transplant recipient since 11 years. And I work full-time as an environmental professional in the energy sector. And I'm married and live with my cat and my spouse. And now I will hand it off to, who's the next person?
Whoever you like.
Let's go with Lindsay. No, I'm so sorry. Who's next?
Lindsay's perfect. Let's go with Lindsay. Okay.
Hi, my name is Lindsay Kemp. I am the mother of George, who is 5 years old, and he has received 2 heart transplants in that short time. I live in Edmonton, and I am a high school teacher, and I live with my husband, George, and 2 dogs. And I'll pass it off to Carrie.
Thanks, Lindsay. I'm Carrie Payne. I'm a mother to 2 wonderful children. My daughter is 18 years old, Jordan, and my son is 16 years old. His name is Atticus. Atticus is a heart transplant recipient, and he's 13 years post-transplant. And we live in Edmonton. And I will hand it off to Toby.
Hello, my name is Toby Boulay. I'm the father of Logan Boulay, who tragically passed in the Humboldt Bronco tragedy. Logan is responsible for the Logan Boulay effect and partially for Green Shirt Day. I represent Angel families, and I live with my wife Bernadine, who's a grade 2 teacher. I'm a retired high school teacher. And I'm going to pass this off to Dave.
Hi, my name's Dave Mathers. I'm currently waiting a kidney transplant. I was actually scheduled on September 8th to have one, was in the hospital, and was canceled because of the current situation. I live in Calgary. I'm married. I'm retired. I have a daughter that lives in Edmonton. I'll now, I guess, pass it back to Heather.
We've got a couple more panelists to meet, so why don't we pass it off to Kieran?
Everybody, I'm Kieran Heller, and I'm a lung transplant physician here at the University of Alberta in Edmonton. I'll pass it off to Justin Weinkoff.
Good afternoon. My name is Justin Weinkoff. I'm also a transplant respirologist based on colleagues with Dr. Holleran, and I'll pass it off to Karen Dussette.
Hello, I'm Karen Dussette. I'm a transplant infectious disease physician here in Edmonton. And now I think I'll pass it back to Heather.
Thank you so much. Thank you everyone for introducing yourselves and giving us a little sneak peek into your connection to transplant. We are very much looking forward to hearing more from each of you. We are now going to turn it over to Dr. Kieran Heller, Dr. Justin Weinkoff, and Dr. Karen Dussette to share what they are seeing and how it's impacting care.
Thanks very much, Heather. So just, we're trying to be as brief as possible here, but, to cut right to the chase, we're seeing people get sicker and we're seeing people passing away of COVID and of other causes. So on the post-transplant side, the most thing that we're seeing is solid organ transplant recipients across the board being admitted to hospital despite vaccination. And before vaccines rolled out, we saw them coming in very sick, but we're seeing them come in very sick even despite vaccination. And we were worried about this, but we see them go to ICU, and we've seen people pass away despite the vaccines that they've received post-transplant. And just a reminder, just like everybody on the panel, these are people leading full, meaningful lives. They're not unwell or infirm. They have families. They are members of the community, and so for them to be affected by what we feel is a preventable illness right now, if we implement the appropriate measures, is I think heartbreaking for everybody involved. On the pre-transplant side, there's a much more complex issue with basically hospital resource overwhelming, and I think Dave reflected this to some degree. We're having issues accessing testing for patients to work them up for transplants. We're having issues accessing donors because with the ICUs so overwhelmed, the ICUs are not able to produce those donor offers, and compounded by the fact that many of the patients they have are COVID patients who are usually not eligible to donate. We're having issues accessing post-operative beds for patients for transplant. And the most worrisome thing is if this ICU triage comes into effect, pre-transplant patients, by and large, because they have end organ failure, are not candidates for ICU. They'll be excluded from ICU level care. And everybody in the transplant community finds this to be an unacceptable situation. It's untenable on both sides of transplant. And so the impetus behind this today was to provide a voice for everyone in the transplant community, most notably be the voice for the patients, because they've been, to some extent, I think, lost in this equation. And I'll hand it over to Justin.
Thanks, Dr. Holler. And my job today is to tell you that I'm going to reveal a story which sadly is a tragic one and a cautionary tale, but unfortunately not unique, and it's increasingly common. Just overnight, I admitted another patient with a new COVID-19 infection in a lung transplant recipient. And the story I'm going to tell you is difficult in that this fellow, he was middle-aged, close to my age, and he was only 2 years post-transplant, and he became ill in late summer after attending a wedding. And he had been vaccinated twice, and so had his wife. But unfortunately, a large contingency at the wedding had not been. And despite the fact that this wedding was outdoors and he only briefly attended the reception, he was infected with COVID-19, and so was his spouse. The patient, within a week of the wedding, developed symptoms of cough and fatigue and malaise, and rapidly developed worsening respiratory failure. And though initially he received multiple different therapies, and we thought we may have the upper hand, he continued to deteriorate to the point where he required intubation and mechanical ventilation, i.e. life support. And despite all these therapies and despite life support, he went on to pass away of respiratory failure. As alarming is 3 other members of the family that attended that wedding ended up in ICUs in Edmonton, spread out across the city. Almost an unimaginable horror story for this family. And as I said, most of this family, including the other 3 patients that went to ICU, were unvaccinated, which is a story we continue to hear over and over. And these people were immune competent, i.e. not transplant patients. And so this family now has certainly changed their mind and has considered speaking out about vaccination, but the pain of the situation has led them not to speak to media about the situation yet. But I'm here to tell the story, and I do not want this happening to other families. I continue to warn transplant recipients to be with loved ones that are vaccinated only, and to get vaccinated themselves now, including a 3rd dose. And so sadly, I think this chain of transmission could have been prevented with the contingency at the wedding being vaccinated. And I'm going to continue to promote vaccination as I see it really the only way out of this pandemic. And now I'll hand it over to Dr. Dussette.
Thanks, Justin. So I'm going to talk a little bit about my roles as a transplant infectious disease physician in trying to help develop patient information as well as guidelines for programs in the donation and transplant community, as well as how that intersects with my role as a clinician and what I'm seeing. I do see there's a bit of a request for some stats in the chat, and I'm going to address perhaps some of that, although there may be other questions. So I have been involved in development, as I say, of materials for patients and families to help provide information about, how best to protect ourselves during the COVID-19 pandemic. But in my clinical practice, particularly, it is much more striking during the fourth wave. I've been increasingly involved in caring for transplant patients who have breakthrough COVID-19 infection despite vaccination and despite following public health guidelines as they exist. Vaccination remains a pillar of limiting the risk, but even with 3 doses, about a third or so of transplant patients remain at risk due to reduced vaccine response in the setting of the need for chronic immunosuppression. Overall, vaccine still lowers the risk of severe disease in transplant recipients by about 40%. However, the breakthrough rate of infection should a transplant patient be exposed to COVID-19 is upwards of 80 times more common than in the general population. And in those transplant recipients who get breakthrough infection, they're over 400 times more likely to get severe illness compared to the general population, where we know breakthrough is occurring, but it tends to result in mild infection. And this has been devastating for patients and families. And I have spoken to several who are angry, frustrated, overwhelmed that they have done everything that they can and everything they've been asked to do to be vaccinated, to follow public health restrictions when seeing that others are not. And in fact, are now being asked to continue to follow very strict to stay home as much as possible, to avoid crowds, to not do the things that in fact the majority of the public are being told they're now allowed to do. They need to continue to maintain strict isolation because of the ongoing risk. And when a breakthrough infection has occurred, I've also heard from family members, how devastating this is and how guilty they feel as well in some cases that they, what could they have done more to protect their family member. I have a slight bit of optimism that cases appear to be stabilizing in Alberta and vaccination rates are slowly creeping up. We've seen some changes again in policy from our government yesterday in terms of schools, but there are many, many challenges. These things have come late. Our healthcare system remains overloaded and backlogged. And I also do know that this virus will continue to disproportionately impact transplant patients, the donation and transplantation community, families in the future go forward, and that there is a lot of work that's still needed to limit this. Hopefully in Alberta, we will also soon see the approval of some early COVID-19 therapies that have been shown to significantly limit hospitalization, can reduce the risk of hospitalization by 70 to 80%. These have been approved in some other provinces. And as I say, I hope we will see this soon in Alberta as another tool to add to our armamentarium. But this pandemic has impacted so many people in so many different ways, and I do look forward to hearing more from our patient and family panel, and so I'll turn it back over to Heather.
Thank you so much. Thank you to Drs. Halloran and Weinberg and Dussette for sharing behind the scenes what's unfolding and the impact on care and their thoughts on the very difficult situation right now. We're now going to turn it over to hear from Tiza, Lindsay, Dave, Carrie, and Toby. And this is the question that we're posing to you. How are you impacted by the current high rates of COVID in the community in Alberta and Saskatchewan, or by the overloaded healthcare system? And we'll go to each of you in turn. And Tiza, would you lead us off, please?
Thank you very much. So prior to COVID-19, I had a full life. I traveled to 27 countries. I competed in the national and world transplant games. I play a flute and I play in a community band. But now, since COVID has been around, I've had to basically stop all the activities that I enjoy and I self-isolate at home, despite having 3 vaccine doses. I'm triple vaxxed. And, you know, it's hard because I'm seeing everybody go back to their normal lives and I'm still at home and I'm not able to go out and see my family or friends. I'm not able to go work in the office. And it's even harder because, you know, like I'm really pro vaccination because I feel like that's the only way we're going to get out of this if we have strong immunization in the community. And, you know, and I post these things on social media because that's one place to get proper information out. And, you know, it's really been disappointing, the response on social media. Like I get friends, people who I think are my friends, or and they're really just, you know, harassing me on Facebook in terms of like, I get private messages about their anti-vax stance. I would get multiple comments on my posts. It would be not just on my wall Facebook profile, but it'd be multiple Facebook profiles from the same person. And then, you know, like sometimes I would receive comments that, you know, people would tell me just to shut up and lock myself at home and, you know, just, you know, collect a government check. And, you know, I'm really offended by that because I'm normally a contributing member of society. I pay taxes. I sometimes do volunteer work, and, you know, I'm a wife, I'm a friend as well. And, you know, I'm part of this community and, you know, I want to continue, you know, contributing to society, and I can't right now. Like I'm basically in a house arrest is how I put it. And I can't see anybody, can't do anything. And it's really anxiety provoking that the hospitals are full, and should something happen to me, whether it's simply not related to COVID or I get a COVID infection, I'm not confident that I'm going to get any healthcare at all. And so that has been really anxiety provoking for me. And so it's been difficult to manage. And that's very much all I have to say at this point. So I pass it off to Lindsay. Thank you.
I'm probably going to be repeating a lot what Tiza said here. I think 2 of the major definitions our family would say for COVID for us right now as a transplant family is that we feel forgotten about and we feel a bit trapped now. So the ways COVID has impacted our family. So first and foremost, my son, George, he's received 2 heart transplants. His second heart, he received 2 weeks before the world, I guess, shut down. We were in hospital for 8 months and he received his heart, and then we got home, and then the COVID was full force. And so because of that, he's just, through his illness and now with COVID, he's really been not able to do what other kids do. We haven't been able to put him into extracurricular activities. We really were excited that numbers were lower in the summer, and we're like, okay, he's going to get into kindergarten now in person. But then all protocols were taken away, and the safety measures weren't there anymore. So I think 2 days before school started, we finally had to say it's just not worth it. It's kindergarten. So we put him into online kindergarten, which then now the trickle down effect. I can't work. I'm a high school teacher. I teach band. And so I have to stay at home after 5 years already not working due to health. I have to stay at home even longer, which I can say we're very fortunate that we have the luxury to do that, actually, because there's many transplant families that we know who had to send their kids to daycare, had to send their kids to school, which was terrifying for them because all the safety they have is what protocols were put in place. So if those school boards didn't put in those protocols, it kind of feels like you're sending your child out to the wolves there. There's always the risk-benefit analysis we have to make every time we do an activity as a family. We constantly are watching the numbers. When is it safe to do something? What part of Alberta are we in? Do we feel safe enough to go out and do those activities? So it's frustrating and it's exhausting. Seeing family, all of our families are vaccinated and know to be careful with us, but we also, there's some guilt involved that if they want to see us, they kind of have to stop their lives. You know, his cousins are in school now, so do we get to see them anymore? Nope, he doesn't get to see his cousins, or if they do, they mask, and that's hard in itself. He kind of he keeps asking, George asks, when are the germs going to be gone? When can we not wear a mask with our cousins? Even my own emotional health, I hear teases in music. I'm a music teacher, I conduct community bands. And right now, sitting in a small room with 50 people blowing their aerosols seems like a nightmare. And so I just haven't been able to do that. So the mental, emotional health of that is really tough. The hospital is being overloaded. If George needs his cath coming up, we have a few friends whose caths have already unfortunately been postponed. So, you know, that important check for rejection, and George has already been through that, needing another heart. What if we don't get ours on time, or what if something is missed? That's it's just pretty scary. So I would say those are the major ways that COVID has impacted our family so far. I'll pass it off to Dave.
Hi, my name's Dave Mathers. I'm currently waiting for a kidney transplant. My kidneys don't work. I do dialysis 3 times a week for 4 hours each session. I was scheduled for a kidney transplant on September the 8th. I was already in the hospital. My donor, who's an anonymous donor, was in the hospital at the same time. They were doing all the pre-work up the evening before to get us ready for the operation the next morning, first thing. I'd already done my COVID swab, various swabs. They've done vitals. I was talking to a pharmacist, going over all my prescriptions. Then my surgeon walked in and let me know that to no fault of my own or to my donors, that they're going to have to cancel the surgery. So that was it. I had to make the hardest quick text of my life, or send it to my wife and daughter and tell them that believe it or not, it's over. You got to come pick me up. And now I wait. I will say, I mean, how does it affect me? I would argue that if I lived anywhere else in Canada, any other province in Canada, any other state in the United States, anywhere, the only place I could live where this could have happened was Alberta. It's a shame. It's an embarrassment. I mean, how do I feel? I mean, we could all imagine what it's like. The rug was pulled out from under you. I mean, I still got to stay optimistic, and hopefully we can start to resume surgeries pretty quick. My fear and worry is more, I mean, I'm going to be there. I need the kidney. I have to have the kidney, but my worry is I have an anonymous donor and they have a life. And, whoever it is has been incredible, but at some point it will not work for them. At some point, someone in their family will get sick. They'll get sick. Their work situation might not permit. Something will happen, and I could lose my donor. We've been testing for over a year now. Of course, we're all fully tested. You just want it to happen. With that, I'll turn it over to Carrie.
Thanks, Dave. That's heartbreaking. I'm mom to Atticus, who's a 16-year-old heart transplant recipient. And as everyone's aware, Atticus, because of the medications he's on, will never build healthy antibodies. And so since COVID, our risk comfort level has shrunk considerably. I've just written down a couple of points because I'm not good with public speaking. I'll just read to you. Our family has always been conscious of mitigating any of the health risks that we could inadvertently expose Atticus to. Since COVID, I have been working from home. There are immediate family members that I have not seen because they're not fully vaccinated. I myself was scheduled for surgery on September 16th, only to be informed on the 14th that has now been postponed indefinitely due to the capacity constraints in our healthcare system. So now I wait. Last year, Atticus moved to online learning at the start of grade 10, and he's still at home today. He is not a candidate. He has bilateral hearing loss. He's not a candidate for cochlear implants and cannot wear hearing aids. So we had arranged to have an ASL interpreter present in all of his classes. Moving online has changed this. He has to work twice as hard to keep up during the online instructions. Atticus had qualified right before COVID for the Alberta bowling competitive travel team. But since March 2020, he hasn't stepped foot in a bowling alley. He meets with a psychiatrist weekly for support. This was originally funded through Kids with Cancer, but since COVID reduced their ability to fundraise for this program, we now cover the weekly costs. I feel this has been even more challenging for my daughter, Jordan. How do we as parents balance the mental health of our healthy child and the mental and physical health of our chronically ill child? It has been impossible. Jordan has celebrated her 17th and 18th birthdays at home. She made the senior basketball team in grade 10, but has only been able to participate in Zoom basketball practices in grade 12. She attended a drive-through graduation and there was no celebration with friends after the event. I'm happy to say that Jordan was accepted into the University of Toronto this year. Talking to her this past several weeks, it has become apparent to me that she is now able to enjoy the ability to function freely in society as a double vaccinated individual. She assures me that she is still taking the appropriate precautions, but she no longer has to apply the same level of our what if factor on a daily basis when living with Atticus. This weight has been lifted from her shoulders and she just sounds happy and relaxed. COVID has exposed how much more stressful living with or being an immune suppressed individual is. And I think the only message that I could ask is that people understand this is bigger than one person, that everybody has to take care of each other. And for those who can't ever build up antibodies, it's up to everybody else to step up and help. So if you can, please get vaccinated. And that's the end of my story, so I'll pass it on to Toby.
Thank you. I'm devastated by hearing the stories of the other panelists. It's just very extremely difficult from my situation, from my family situation. As people know, Logan was an organ donor and inspired many people to sign up to be organ donors. I don't know. It's exactly what Carrie said. It's bigger than just one person. It's not about Logan. It's not about me. It's not about any of us individually. It's about our community. And our community is Alberta, and then that's also Saskatchewan. And people in our community aren't thinking about the team. They're thinking about themselves. They're vaccine hesitant, and that's caused, as we all have been talking about, massive difficulties within our healthcare systems. It's postponing organ transplants like Dave. It's putting other people like Lindsay and Tisa and Carrie into difficult decision-making spots with their lives. I read last week that a family in Alberta, their young child, their boy passed away, and they're unable to, and they wanted him to be an organ donor, and they're unable to donate his organs because there was no space. They're not accepting organs from deceased individuals in Alberta, and certainly in Saskatchewan, they've shut down all their transplant programs. So what I've done, and what my wife has done, but not so much her because she works full time, I retired, is we speak out. And that's all we can do right now, is because Logan's done his bit, and we speak out to anybody who wants to ask, and people call and media outlets call us, and we do interviews and we never say no. We speak out and we speak against the decisions that have been made by governments. We speak out in favor of families that have spoken today, and we support as best we possibly can. We're not scared to say to anybody what we think needs to happen, and what has happened is a tragedy. And I just want to pass this on, and I'm just grateful that I was given the opportunity to speak today. Thank you.
No, thank you. Thank you so much to Tisa and Lindsay and Dave and Carrie and Toby for sharing these very personal stories with a great number of people listening who can hopefully help to make some change. The impact on families is dire, and I'm sure I'm not alone, and joining with everyone else on this call when we say that you're in the hearts of everyone on this call. Our hearts all go out to you. We're now going to move on to a few questions and answers. So both attendees and media are invited to ask questions. We've been collecting them from the chat, and so we would ask you to put your questions in there. And I'm going to start by asking a few, the first question, and whoever is most appropriate on the panel to answer could jump in. So this first question says, I'm on the kidney transplant list and have received 3 doses of Pfizer vaccine. I live with my wife who refuses to take the vaccine. What are my risks? And so a related question is, how important is it to have your spouse or family members vaccinated?
So maybe I will start with that. You know, I shared some of the data around vaccination in transplant recipients, which, you know, again, remains extremely important in providing protection, particularly against severe disease, but provides incomplete protection. And so there are a number of strategies to try to lower the risk of acquiring COVID-19. And one of those key strategies is what's sometimes referred to as ring vaccination, or kind of building a cocoon so that the close contacts around that person who, you know, will mount a better response and help protect that immune suppressed individual. So, you know, it is very important. It's something that we always discuss with patients, not only in COVID, but other, you know, influenza, for example. This has long been the case as well. So it is very important. If breakthrough occurs, again, it's relatively, you know, provides relative protection, but the risks of getting severe disease are certainly much higher in a transplant recipient.
Michael, if I could just add to that, I think that the one piece of good news is that a lot of the things we're talking about poor vaccine response are in transplant recipients who are immune suppressed, and you are before a transplant. So, you know, as long as you're not on immune suppressive medications, you should have a good vaccine response. And so your protection is probably pretty good. Your risk of COVID is higher because you have an organ failure, but your vaccine response should be good. And that's a big initiative for us to make sure we're getting patients vaccinated before transplant, because we know that the vaccine response before transplant is superior to the vaccine response after transplant. So you've definitely done the right thing. As Dr. Dussette said, I think that the idea of a cocoon of your immediate family is really critical for everybody, and really thinking of it more broadly, that your community immunity is another layer of that shell. So asking everyone to step up to the plate to protect the vulnerable is how we started this whole battle. That message seems to have been lost somewhere along the way. So that's one of the goals of today.
Very, very important messages. Thank you, both of you. One more question before maybe 2 more. Let's see how we do. The next question is, how many transplant surgeries have been postponed or canceled due to the pandemic? And if possible, they're asking for a specific answer, which is specifically paired kidney exchange kidney transplants. We may not. Oh, okay.
I just like to say that in terms of deceased donor transplantation, I'll start with that. I know that's not exactly the question. We have not and will continue to fight to not ever shut down the lung transplant program in terms of deceased donation when the opportunity arises. I do not know the number of deceased donor offers that we may not have gotten because of the ICU being, I'm not sure we'll ever know that, but I vow to fight to never shut down the deceased donor side of the program if it's at all within my control. I know there have been several living donor opportunities missed or postponed, I should say. I don't have the number, to be honest.
I believe it's going to be 8. It was like 6 last week. They're doing one a week in both Edmonton and Calgary, or they were doing it. And so I think that's the number. It's 8. And
I think an important point here is that, and one of the reasons Dr. Weinberg says we'll never know, is because probably much more important than the offers that happen and then maybe get canceled because of scarce resources are the offers that never happen. The ICU is not able to identify the donor. They're not able to, they don't have the resources and the manpower to do donor management, or the system's so overloaded with COVID patients that there are no donors. So the donor opportunities are being affected, and we never know about those donation opportunities, which is probably a much bigger problem than the ones that are lost due to resources.
I would like to add something as well to this question, although I completely agree we will never know exactly, missed opportunity in deceased donation. One good thing that has come out of this is nationally, Canadian Blood Services, there has been collection, actually of more real-time data, which has been asked for decades, and something that has now happened. And so we do have data being tracked nationally in terms of historical trends of donation and transplantation over time by province. And so we know that early on in the first wave, there was about a 30% across the board reduction in donation and transplantation, and that covered and has stabilized. And so I think we will see some data, and we may see I expect differential impacts in Alberta and some of the other provinces like Saskatchewan, where this fourth wave. So that data may become available to get a better understanding of that.
Hi, it's Margaret Lidstone. I work with the Living Kidney Program in Edmonton, and I can tell you that we have today would make 3 transplants that have been postponed, donations. We haven't really been affected by KPD cancellations, except for today, that was the first one. Most of what we have right now was already postponed until November. So we're just being impacted by one chain at this point.
Thank you. Thank you, everyone. Oh, Lori, you look like you might have something.
No, I was just going to just comment and reiterate that it's the donation activity that doesn't happen that's very difficult to, impossible to gauge and to get solid numbers for. Of course, as we continue to go on, there are some numbers that are able to be tracked not only provincially and nationally, but internationally, as Karen mentioned. But it's the impact on overall donation activities that just don't happen that's going to be very difficult. And we may see that at some point reflected in the transplant numbers, but it's really kind of hard to parse out.
Yeah. Okay. Thank you, everyone. We're going to continue with the session. There are really great questions coming in. We are collecting them as they arrive. And so, time permitting, we're going to go through as many as possible at the end. So at this point, we're going to turn it back over to Kieran, Justin, and Karen with thoughts on where we go from here.
I'll just start. I mean, I think that where we need to go in order to, we discussed how to sort of try to wrap up the session. And I think we want to end on a note of hope and action. And I think that we've got lots of people on the call today. I think there are some members of the media here today. We just need to get this message out. I think it's not a message that people have heard. And so if we can get this message out about again, we started this journey trying to protect the vulnerable in society and trying to prevent this very thing that's happening right now, the overload of the system. And now we're here and we're not really doing what we need to be doing about it. We're not doing all the things that we did early on that prevented this. And so if we can get that message out, and all the people who are on the call, you have no idea how important your advocacy is here today. But everybody else, every recipient, every candidate, every family member, if you can send letters to your MLA, send letters to your MP, and have that voice as a collective, that's very powerful. And I think that if we can, concentrate our efforts together, we can have a much stronger voice, and we can, promote the change that we need to protect you guys and to get you back to the lives that you did the transplant for. I don't know if Justin or Karen have any additional thoughts.
Well, one thing I remain optimistic about is the ongoing science towards looking for therapeutics towards actually targeting the virus. I mean, there was some early data that's, phase 2 trial from Merck just released this week suggesting that, it can soften the blow of severe infections, a new therapeutic. And so I do look forward to a different weapon or tool to actually treat the infection once it's already diagnosed. I think there's optimism there. And I was optimistic about the trial that came out of Toronto, published in the New England Journal, showing that after a third dose, there was actually a higher antibody response to the third dose of COVID-19 vaccine, in that case, Pfizer in that trial. And I don't see how it'd be any different with the other mRNA vaccines. And whether that translates into more protection or not, we still don't know, but I think there's optimism. Just, I think there's potential. I think everyone's doing the right thing by getting a third dose that's immune compromised, and I hope that translates into lower admissions and lower hospitalizations and lower severe complications.
Yeah, and I don't have too much to add. I will echo Justin's comments about optimism around the science around early therapy. I also think that there's important spillover of the lessons learned here specific to the transplant community. As I said earlier, what we're seeing here is not new in terms of lower immune responses to vaccination and higher rates of severe disease. And I think that this is an opportunity, for myself as a transplant ID physician and as the community of transplant clinicians to really, take these lessons learned to other conditions as well, and to try to improve lives, health, outcomes, and lower the risks in our transplant population for a variety of different infectious diseases. I think today, I think the optimism is that together we have a powerful voice, and I think it's incredibly important, and I'm so appreciative of the panel sharing their stories and the impact. And this does have an impact in the broader community. As Kieran had said, we started this pandemic, we're all in this together, and we need to protect the vulnerable. And somewhere along the line, we seem to have lost that in Alberta. But I think that your messages are impactful and can make a difference.
I'll just add, if I may, the pandemic has galvanized in science, speaking to the science of it, has galvanized scientists worldwide and every level of science, every stream of research. It's been actually quite remarkable. And although we see sometimes reports of competition amongst researchers, the pandemic has unleashed amazing collaborations worldwide. And that's why we have vaccines so quickly. And that's why we have a greater understanding of the nuances of this particular virus and how it's changing, and how this remains a quickly moving scenario, the science of it at all levels. So I remain optimistic that the collegiality that we've seen worldwide that has allowed those incredible leaps in the science that's brought us the vaccines will continue to bring us other therapies that will have an impact on this. I would also just like to reiterate the need for collective action here, and the impact that these voices can have on reinforcing the need for sensible public health measures that are, that are so logical to put forward and so important in this particular scenario. So the impact for vaccinations, for contact tracing, for appropriate modifications as we go forward. I think Justin said it quite well. We need to get these collective voices, and Patricia's going to put up an email address at the end where if we haven't answered your questions today, you can send questions, you can send ideas, you can we can all together look at new forums for trying to collect the power of the collective voices here together.
Thanks so much.
I saw an important question in the chat that I wanted to clarify quickly. Jack Dobbs, who is awaiting a kidney, wanted to know if deceased donation has stopped in Alberta. No, it has not. It has in Saskatchewan. That could impact us as Saskatchewan is a place we receive donor offers from frequently, but the donation system in Alberta continues to work, and in BC as well. So we are getting offers. This week I've had several offers for donation from this province. So that's the good news. In Saskatchewan, I'm not sure when they'll be operational again, but.
That's really important. Thank you so much for clarifying, and to the clinicians for sharing your thoughts. Not missed in our conversation, and certainly really clear in the chat, is the need for collective action, and what is it that we can do together. And so I think we're gonna touch on that before we finish. We do have some time for some more questions and answers. We'll see how many we can get through quickly, but also comprehensively. So I just want to check if there are any media in the chat. Please make yourself known. We'll make sure that we get your questions in here. So are there any, this is a question here, are there any statistics on transplant patients who have contracted COVID? Do we know the statistics on how many recovered, were hospitalized, how many have passed?
So, speaking from the lung transplant perspective, which is probably the highest risk group of all the transplant recipients, thus far we've been tracking our COVID infections, and alarmingly, about 20% of them have passed away of COVID. And so that's a risk of dying 20 times the general population. It's probably not quite as high with the rest of solid organ transplant recipients, but it's probably between 10 to 20% risk of dying. And Karen went over some of the risks of severe illnesses, in the range of, in some cases, hundreds of times the risk of severe disease. So, we have asked our transplant services to really give us a comprehensive viewpoint of the COVID overview for solid organ transplantation. We should have that in the coming weeks and months. But the early view is very, very concerning, and is consistent with other publications from other centers around the world. Probably a reasonable estimate is 10 to 20 times increased risk of dying from COVID if you get it. And as Karen outlined, an increased risk of breakthrough infection if you're exposed to it.
I can provide a little bit of stats more broadly. So we do have some early data that are pulled. So they're pulled through our electronic systems in Edmonton. So it captures kidney transplant in Edmonton, not Calgary, and solid organ transplant, otherwise non-kidney, for the whole province. And there were, as of last week when the data were pulled, 238 lab confirmed diagnoses in Alberta. And of those, the number that passed away was, it was about 13% overall. So as Kieran has said, higher in lungs than non-lungs, but overall still incredibly elevated compared to the general population. It's similar to what Toronto has described at about 15%. And in their series, they also looked at hospitalization, which is actually 60%, which is massively increased above the 5% rate in the general population. So.
And I want to emphasize, I think William in the chat sort of had said, he had a mild case of COVID. That's absolutely possible. And this is not to say that every person who gets COVID after transplant will become gravely ill, require hospitalization. It's just that the proportion of patients who get very, very sick is so much higher. But certainly we've had patients who have almost no complaints, are surprised that they have COVID, and that can happen. So it's not. I don't want you to think that all hope is lost. That if by some chance you get COVID, that all hope is lost, but it's just a very alarming increase in the risk.
Okay.
Hi there. This is Michael Corey, pediatric cardiologist with the transplant team. I just wanted to just perhaps provide the other side of the spectrum of severity that thankfully, similar to pediatric data in non-transplant patients, the mortality rate from pediatric heart transplant recipients with COVID is not nearly as high, thankfully. It's still the risk for severe illness is quite high compared to the general population, but we've been surveying this data across the Pediatric Heart Transplant Society across North America, and the number of mortalities has been less than 5 secondary to COVID infection in pediatric heart transplant recipients.
That's fantastic news.
Thank you for jumping in. It's helpful to have a balance in this conversation. We know that it's a serious risk and that it's important to get vaccinated and stay safe. We're also hearing some reassuring words that hopefully set some minds at ease a little bit. So thank you for that. We have time for possibly one more question unless I get told that we can extend the time. So this is going to be a quick one if we can. Are there testing options to determine the immunity of a transplant recipient after 3 doses? For example, tests for T cells and antibodies.
So I guess I'll take that to start anyway. So testing after vaccination in routine practice is not recommended. The reason is, so the studies are done when the vaccines are being studied to look at antibody responses and T cell responses. And those are compared to without vaccine and compared to, the general population. The challenge is we actually don't know what the correlates of protection are. So we can say that, in a transplant patient, the antibody response is 65% versus 95% in the general population, but we don't actually know what that means in terms of protection. On top of that, so commercially available, there are antibody tests that are now licensed, but again, having an antibody test and saying it's positive does not mean that you're protected against severe disease. And having a test that is negative, in fact, doesn't mean that you're unprotected, because there are data that show at least 50% of those transplant patients who don't have, an antibody response, at least in the range that we think might be protective. About half of them will still have T cell responses that can protect them from severe disease. So this is why it is not being offered routinely. It can be falsely reassuring or falsely more concerning. So I know that's challenging because it means that people, you don't know and have to continue to follow those strict public health guidelines until hopefully we can see the cases and the risk come down.
Thank you. Thank you for
sharing that. If I could just jump in, we could just add that there are a number of ongoing studies. One that's being carried out together with the Canadian Donation and Transplantation Research Program across Canada, in conjunction with the immunization agencies of Canada. And we hope to have emerging information on the specific impact in transplant patients and these various tests. And we're also keeping a very close eye on the international studies that are being done as soon as they're being reported.
It's a really helpful addition. Thank you, Laurie. I'm being told we have time for one more question, and here it is, before we hand it back to Laurie to wrap us up. So the final question is this: how can we disseminate these impactful stories and these difficult journeys out to the general public? Everyone here is informed and knows the importance of vaccination. How do we expand the audience?
Feels like we're preaching to the converted today, but that's the $1 million question, I think. I guess I don't have the answer. I'm not expert in that, but I'd love to hear someone else.
Well, I think Justin put it out there. I'll just say, I mean, these letters and messages to, at least as far as responses to public health restrictions, the public has a voice there and can write to your MLAs, write to the Premier, write to, I mean, add to the voices. We've had voices from the Canadian Society for Transplantation. We've had national voices from the Canadian Society for Pediatrics, from the Canadian Medical Association, and these add to the provincial voices from these from various groups as well. But you as a group, you know, those of you who are patients and families and are struggling with this, you have voices as well that can go right to the government. We're happy also to collect through the ATI additional voices and happy to support with letters to the government from the ATI your voices and collecting those, but they matter as individuals too. So please don't forget that.
And we are trying to engage with the media about this. I know some media are here, and there's been some, you know, reach out from the media about this issue. So, you know, we're trying through that avenue. I think, you know, putting those out on social media, speaking as a collective on social media is powerful. Again, as someone notes, to counteract some of the downsides of social media. But I think we need to move the government on this. We need to move the government now on this, and to make them aware of the vulnerability, and to let these stories, which everybody has been awed by and are so impactful, we need them to hear these stories. So I would say the most impactful thing is to reach out to government. As a collective or individually, and that's, you know, the health minister, the premier, the medical officer, chief medical officer of health, and your MLA are probably your four main targets that you want to send information and your story to.
I agree with Kieran on that issue, but you need to, having gone through this for 3.5 years, not just organ transplantation, obviously, you have to CC your opposition, because they're the ones that are going to bring that forward into the House. They're the ones, your MLA can ignore you. Trust me, I've been ignored by many MLAs. But when we finally got a hold of Mr. McIver on the trucking issue, all of a sudden he wanted to talk to people. You have to go to the media. Everyone in this group today has a story to share, and you have to go to the media and not be scared to share your story with the media. You need to have 1 or 2 facts down solid. And then you stick to those facts, and you stick to that, and don't let the MLAs off the hook. Don't accept their talking points. Don't accept their position they've been told to say. Push and push and push and push, and you'll get what you want. If you don't push, next thing you won't get a chance. And on that last little point, that's how you get media attention, by being someone who steps forward outside and says, this is wrong. I have a story to tell. You want to hear my story. And that's how you do it. And you got to push, and you can't be scared. The media are great people in Canada. We're not talking about what we're hearing other places. In media in Alberta, mainstream media are fantastic people. Stay away from the non-mainstream people. They're not going to help you. Stick to the mainstream, connect with a source, work with that person, and you'll be surprised how much can happen for this cause. The worst thing we can do today is shut down our computers and hope that the next person beside us does something. You need to do something. That's all I have.
I'd like to add, thanks Toby for that. Holler and I this week have reached out to media, and they were quite receptive in hearing Dr. Holleran's letter that he wrote to the government, and I shared a patient story yesterday, a different one than I told today, and I think they'll be, you know, airing that soon. But I think hearing the voices of people who are directly affected may have better traction at this point than a physician voice, who maybe some people have tuned out at this point. So I would encourage any person that's been affected by this, especially on the non-physician side, to speak out, speak now, and speak loudly.
And I just want to say, Toby is a fantastic example with the media, with a problem, and with a message. So, you know, look to that example. That's a fantastic illustration. Thank you, Toby, for sharing it.
Thank you.
Absolutely. Yeah, Toby, you're a great example of how individuals can bring tremendous change and have tremendous impact. So thank you for modeling that for the rest of us. This brings an end to our session for today. Tremendous thanks to all of our panelists, all of our audience members. This was a lively discussion, not just here on screen, but also in the chat. Really appreciated everybody's comments. We are collecting the questions. And so thank you to everybody who was here, who stayed a couple extra minutes. And I'm going to pass it back to Lori to wrap us up.
Yes, thanks so much, Heather, and thanks to all the panelists for making yourselves available and for being so frank and forthcoming with your thoughts and your comments. We will follow up. You've got the address, I think it was posted there. Please send suggestions, more questions, and we will follow up with this. And if the occasion arises to have a second follow-up session, we can certainly organize that. I would just like to tell everyone that the Alberta Transplant Institute does have a weekly seminar. The public is invited. You're all welcome to contribute suggestions for sessions and ideas, and we'd very much like to hear from all of you. So this is a tough time. It's a tough issue, but together we can move forward. I have full confidence in that. So thank you all very much for participating. And thanks again for our organizers, the Kidney Foundation and Canadian Transplant Association, for helping us organize. And thanks so much, Heather and Patricia, for the organizational help too.